Hi everyone, welcome to this episode of Diverse Talk Matters. To talk about different things around diversity, equity, inclusion, talk about things that people may find challenges with, so we hope you find them really useful. Some are around people's different lived experiences, some really challenging conversation, things that sometimes we don't need to talk about. But we really hope you enjoy the range of topics that we are introducing to you or bringing to you, to your homes, to your house, to your workplaces. We hope you enjoy. Hi everyone, and welcome to this episode of Diverse Talk Matters. Today we have the wonderful Bea Innes, who's got a wealth of experience in disability equity and inclusion, welfare, carrying out assessments, workplace and employee wellbeing. So much more you'll tell us about that anyway, but welcome, Bea.
Thank you very much. Lovely to be here.
Nice to meet you. And tell us a little bit, for those of you who don't know you, tell us a little bit about yourself and how you got to do the work that you are doing today.
Yeah, sure. So, at the age of 24, I was working full time. I was partying hard, young person,
Good.
and I got a virus. And that virus put me in bed for 8 years, and I became completely, well, I was, basically in bed for 8 years. I had to have social care. I had personal assistants that had to help me do everything from preparing a meal to washing and bathing. I lost the ability to read. And that was how I entered entered the world that I am in now. And basically back then I was diagnosed with ME. It later turned out, I found out that it was also Lyme disease that had gone misdiagnosed for years. And back then in 1996, I'm kind of giving away my age here now. There was very little known about ME. We were kind of dealing with the aftermath of the 80s where people were still referring to it as yuppie flu. And people with ME back then were thought to be kind of malingerers or they just need to try harder. And very little was known about what was going on physiologically. We know so much more about the physical nature of the condition now. But at that time, I was kind of left to it, really. I tried anything and everything. You named it, I tried it. And it was what I do now in terms of naturopathic nutrition and functional medicine that got me back to health. So I trained purely for selfish reasons when I recovered and basically started really training to find out how to keep myself on track. Because when I was working with my naturopath, they didn't necessarily explain to me why you should eat this or do this detox technique or take this supplement. And when you don't really understand the why, it's a lot harder to keep going with it all and be motivated. So that's why I really retrained. And then when I I qualified in 2015 and discovered all of the amazing things that you can transform through nutrition and lifestyle medicine. There's a nutritional protocol for just about every health condition under the sun, and they're all different. I was kind of blown away, and that's when I started my clinical practice. But in the meantime, when I first got back to work, um, I didn't really know what to do. I've been out of the workplace for about 11 years, and background in training and development, but really had lost my confidence. And I ended up working for Citizens Advice, volunteering, doing debt, welfare benefits and employment law. And that kind of led me then into the world of disability. And luckily started working for a disabled people's organisation. I started off in an admin job because I'd lost my confidence. And within about 6 months, I was running an information service for disabled people over in Trafford in Greater Manchester. And then that kind of started my life as a welfare rights work and disability rights, really, and disability awareness training. So, yeah.
So, just for those people out there, quite a few things you said, and I thought, right, can you, because I know there's a lot more awareness. You hear about quite a lot of people now having Lyme disease and ME. So can you just tell us what the symptoms are of those two things? Just in case anybody's out there, you never know.
I think the main thing with ME is the debilitating flu-like fatigue that happens after minimal physical or cognitive exertion. So you could be having a conversation with somebody for 15 minutes. That was my limit of how long I could talk to somebody without it feeling like there were fireworks going off in my head. So yeah, that post-exertional exacerbation of symptoms is really quite profound and a real kind of key symptom of ME. Also, I would say, I mean, it's an invisible condition. So people imagine that you've got flu. It's like that kind of fatigue that you've got when you've got flu. So a lot of people think, oh, people with ME, they're tired. And certainly that's how it's looked at through the benefit system, which we'll talk about later, I'm sure. But yeah, it's so much more than tiredness. Imagine that you've got flu, you've just run a marathon, and you've not slept all night, and put all of those three together, and you might be coming close to the level of fatigue that you've got in terms of ME. And it fluctuates, as well, which can be really
Of
confusing
course.
for people.
Yes.
I see someone with ME doing something one day, and then you'll think, well, they're absolutely fit and well, and there's nothing wrong with them, and you won't see that they're in bed for 3 days afterwards. So that's another kind of telltale sign. Lyme disease is a lot of the symptoms are so similar.
Okay.
And I know in functional medicine, we look at, when I see in my clinical practice, when I see somebody with ME, I'm often looking for, right, have they had mold exposure? Because I did as well, and that can trigger very similar symptoms. Have they been bitten by a tick or any kind of like vector kind of carrying insect? Um, but yeah, very, very similar symptoms with Lyme disease, which is why it was misdiagnosed for years. Um, I think a lot more neurological symptoms with Lyme disease, so kind of like burning and pain that moves around the body,
Okay.
burning kind of tight pains and sensations, which again could be diagnosed as fibromyalgia or ME. Lyme is quite often missed because you don't always know you've been bitten either.
Exactly. Lovely, thank you. So that'd be really useful to people out there because, like you say, this is about as well promoting awareness. And like you say, it's one of those not immediately visible disabilities. And it's one that people might think. And I remember that thing, yuppie flu. I remember, gosh, bringing me back now. And I think, wow, it was seen so negatively. Like people were lazy, like people were, oh, they're not really ill. Like you say, they need to try better. And then you think,
Mhm.
wow. And so I am sure because of that, the medical profession at the time probably, I mean, you said, it took you 8 years to recover. And how did what were the challenges? And I think that's probably why you're doing your natural, your holistic approach now. What were those challenges over those 8 years while you're recovering?
Wow. I could write a book, and
I bet you could.
people have told me. So, it actually took from the time that I got ill to the time that I sort of came back to life. And
Yeah.
it's been a journey as well. Took 11 years from beginning to end, and 8 of those I was in bed. Um, so my first challenge was getting a diagnosis. That was my first challenge. It took me, I remember going to the doctors when about a month in. So after I got that I was kind of about a month later, the viral symptoms had gone, but I was struggling to stand up in the shower. I was going out with my friends, and then by 10 o'clock in the evening, I was sitting on a wall and they were, let's go to a nightclub. And I'm like, what's going on? So went off to the GP and they said, I thought I'd had glandular fever, which it turns out I had, Epstein-Barr virus. But that was just one of the triggers that kind of pushed my system over. Uh, And I think the other thing to say, sorry, I'm going off on a bit of a tangent
No,
here,
go for
but
it.
I've just written a newsletter on LinkedIn. I do like an employee wellbeing newsletter, and it was for Stress Awareness Week. And I wrote about how people normalize symptoms all the time. And that's what I was doing before I got ill. So there were so many signs that my body was going out of balance. I just brushed them all off. And we do, headaches and allergies and digestive issues and hormonal issues. We just think, oh, well, that's normal. and it's not. And they were all signs that my body was going out of balance. So then when that virus hit, and the bite that I got as well, my system just went down. But you know, it wasn't necessarily the virus. The virus and the bite, that they were the last straw. There was signs that everything was out of balance before that. But back to your question. So I've gone off a complete
It's
tangent there.
fine.
Yeah, so your question was challenges. So my first challenge was getting a diagnosis. So my GP at the
Yeah.
time said, "You'd know it if you'd had glandular fever." And I'm thinking, well, I kind of do know it, but it was kind of like written off, and I was told to go jogging, and I just needed to do some more exercise, which now we know that exercise is the worst thing that you can do when you've got a diagnosis of ME. It's because there's no tolerance, and actually your system's running on empty, and you're not making energy efficiently in ME, basically. So when you're using that energy to try and exercise and push through, which is what I did for years, essentially you're taking away the energy that your organs need to do their jobs. So of course I didn't know that at the time, and for years I was told to push through, and I did, and that's how I ended up in bed. So basically, getting a diagnosis was my first challenge, and that took a year. Um, my second challenge, I think, was learning to live with the diagnosis. And I think years later, I've realised through working with other people with ADHD that I probably do have ADHD. I'm waiting for an assessment at the moment. But I was always very driven, you know, always very motivated, never knew how to relax, never knew how to switch off, always on the go, A-type personality. So once I did get the right advice, which was about pacing and listening to your body and doing less than you feel that you're able to do, I found that advice very, very difficult to implement. Next challenge was getting benefits, hence why I went into that field. I had a lot of difficulty getting benefits. Yeah, I was actually told in my very first benefits assessment, and do you remember the days where we used to have to queue up in the job centre and sign
Yes,
on?
I remember. Yeah, I used to work in a job centre at one point. Yeah.
And I used to have to take a stool because a little like carry stool because I couldn't stand up in the queue. And when I had my first assessment, I was told by the assessor that I needed to stop hanging around with couch potato friends, um, which was a bit of a shocker. So yeah, that was my first challenge, was getting benefits, and then I ended up being entitled to social care because I became less and less able to look after myself. And then had an issue with somebody that worked in social services who was stealing money off the recipients, and he was stealing people's care money. So my next challenge was that I ended up in a legal
My
situation
gosh.
trying to get that sorted out, and had to get solicitors involved. And eventually it was uncovered that he wasn't just doing it to me, he was doing it to other people. And
My
then
gosh.
they,
Awful.
they let him, obviously actions were taken. So imagine stress. We know what stress can do. We're at the end of Stress Awareness Week. Stress can shut down your immune system. It can shut down your digestive system. Well, they were already impaired. And then I had a huge amount of stress just to get the services that I was entitled to. And, you know, we pay our national insurance when we work to be able, it's an insurance scheme so that when we become ill, you know, there are services there that we can then access. It was a challenge, one challenge after another.
Yeah.
And then my final challenges were to find personal assistants that were actually good and could support me in the way that I needed, and that was a challenge in itself. And then I guess things from friends and family as well. So, you know, you don't look ill. I saw you doing this yesterday. That stigma around that health condition as well, huge. So yeah, lots.
Yes, yes, and I'm sure if you thought you'd think of more as well. But also, what I think this is amazing when you say, "Oh, you know, it took 11 years to fully recover," and you thought, "Right, I'm gonna look at." So, what made you? Because a lot of people, and I probably think myself included, if I've been honest, it would be recover and then go, right, I'm gonna get back to this mirror. But what made you think, look, there must be some holistic. There must be some, because what you've done isn't ordinary, I would say, that you thought, right, I'm going to find a way through, homeopathy, through natural ways, through nutrition, that I'm going to be that clinician. What drove you to go, no, I'm going to find a better way for myself and others?
I think the fact that there were no answers, through conventional medicine. So I what's the alternative? I kept looking for something. I tried so many holistic therapies, and then my care package actually fell apart at one point, and I ended up, through the local ME group, I ended up being um, taken to live with somebody, complete stranger that I spent Christmas with. They had to put me in the back of their car. They wheeled me out to the car, lay me down in the back seat, drove me to the house. This lady's husband carried me up the stairs to their attic room, complete stranger, and I lived in their attic for about 3 months while my care package had fallen apart, and thank goodness for them. And this lady, basically, she had a relapse about a year later and started seeing a naturopathic nutritionist. Within a few very short space of time, she had dramatically improved, dramatically. So I was like, look, I thought I'd tried everything, but I haven't seen who you've just seen. Send them to me. And that was when I realised that naturopathic nutrition is very different from standard nutrition, dietitians, etc., in that we're not just looking at what are you eating, we're looking at how can you eliminate waste from your system, how well is your body's routes of elimination working, your bowels, your liver, your lymph, your kidneys, how well are they all working? Naturopathic nutrition has techniques to basically support all of those organs of elimination. So it's not just about what you're putting into your body, it's about what you can get out. And then it looks at lifestyle. We do testing as well, lab testing, that's quite different to the conventional lab testing that you'll get through the NHS. So it's very holistic. And then we look at lifestyle changes as well. So what's your environment? For example, I had massive exposure to mold, and I had no idea that was affecting my health so dramatically. And a lot of the mold was hidden. So what's the air quality that you're breathing in? What are you putting on your skin? What's the water like? What's your stress management like? All of that comes under the lifestyle section. So it was just fascinating, really. And that was what kind of led my recovery through it.
And the thing is, you're saying that now, and I'm ferociously nodding, going, yeah, yeah. But back, historically, you wouldn't even now, I bet people aren't sitting in their houses thinking, is there mold? What's the air like? What am I close to? All those things, because and the good thing is there's more awareness, because there've been those people who are living in really poor housing where that's been raised, hasn't it? Where
Mhm.
whether it's council housing or support housing, whatever it is, where the conditions are so bad with the mold that the people in the family in that house have become ill, haven't they?
Only in the last few years, and really
Yeah,
sadly, that the little boy over, I think it was in Rochdale, he passed away. And they actually, it sparked a law now. But we're still about 10 years behind the States in our understanding of
really.
mold sickness. And yeah.
Wow.
So I'm trained in mycotoxins. So mycotoxins are a gas that mold emits, and it's really toxic to just about every system in your body. And there's only a few of us in the UK that are actually trained mycotoxin practitioners, trained to deal with mold sickness and to spot it. But yeah, it's quite. I guess it's holistic. It's probably very poorly misunderstood, and we are behind the States in terms of the research.
So remind me, look at lifestyle, the things we talked about. What are the things you look at when you're doing your
Dietary changes, lifestyle changes, supplements. So what's a good supplement? What's a bad one? Are you taking the right amount? A lot of people don't know what they're doing with supplements. I also see people that take supplements that interact with their medications. A lot of people don't realise that supplements can really interact with medications, and some can be quite dangerous. When you put the two together, it depends what medications people are on. So we look at that. Naturopathic detox techniques, which have been around for centuries. And then we also look at testing, lab testing, functional lab testing. So
Excuse me, ignorance, what do you look at through the lab testing?
we can look at the balance of bacteria in your large intestine, whether there's any bacteria there that shouldn't be. How well are you producing digestive enzymes? Have you got any parasites or yeast overgrowth in there that's affecting your digestion? Your digestion is so important for your immune system. And we're finding out more and more about the implications of gut bacteria in just about every health condition under the sun, including things like Parkinson's and lots of autoimmune conditions as well. Then we can look at, I do breath testing a lot for people with IBS. At least 60% of IBS people have a bacterial overgrowth in the small intestine, which you can test for with a breath test. We can do hormonal testing. We can look at your adrenals and how well you're managing stress. It's all sorts of things we can test
Telling you,
for.
B, I'm listening to you. I'm thinking I need to book an appointment with you. I'm literally like, okay, yes, I could do with that. I could do with that. So, definitely though. I think there must be so many people who would really value from that. Absolutely. Okay. So that is what so that's one of your main organisations looking at that. And what's it called for people out there if they want to look for it?
Yeah, it's Healthy Bee, so Healthy BE, all one word, .co.uk. There's two sides to it really. So the one side is my private online clinic where I see people with all sorts of health conditions. I do a lot of gut health. I do a lot of female hormones. I do a lot of skin health, but I've seen anything and everything from a little boy with epilepsy up to an elder gentleman with Parkinson's. And, don't get me wrong. I'm not saying I've got a cure for any of these conditions, but there are certainly things that we can do to take control of our health. So yeah, basically that's the private online clinic. And then the other side is the employee wellbeing side. So I go into companies and organisations. I do lunch and learns and workshops around different health topics. So it might be managing menopause naturally. It might be nutrition for neurodiversity. It might be beating burnout and stress resilience. Got one on sleep for shift workers. So there's a whole array of different health topics that I can talk on. And they're interactive. And the aim of it is to give people simple, actionable tips that they can take away and put into practice.
Yes.
That can start to really impact their health and their performance at work as well. And then I do pop-up health clinics, lab testing, so health screening, and also write content for organisations for their intranet if they've got a health hub or anything like that. Lots of things I can do in companies as well. So that's the nutrition side of mine. Nutrition business.
Brilliant. So in terms of employee well-being, because it is a big, rightfully so, the whole thing around well-being is really has got such greater awareness. Most sort of organisations, at least bigger organisations, have got somebody who addresses or leads on well-being. Some people have some key team on well-being. So what do you think is, in terms of what you do, what would you say a good employer should be doing in terms of well-being?
I'm on a mission to change it from being a tick box exercise.
Yeah.
Every awareness day is an opportunity for an organisation to do something, and organisations do things around awareness days, which is great. But how do we stop it from being, we've had a nice lady come in and do a talk once a year on menopause or stress or whatever it might be, to actually, how are we going to support our employees on a regular basis? That's why I don't just do talks. I go in and do, pop-up health clinics and lab testing, health screening, content for the intranet. It's having an engaging calendar throughout the year of things that are going to support, but things that are actually going to give people stuff that they can do to put into practice that's going to impact their symptoms.
Yeah.
It's great raising awareness and talking about things, and obviously people having support, but actually I think what I've learned throughout my life journey is that empowerment is key, and there is so much that we can do to support our own health. And most of us don't know that stuff. And I didn't know it. And I'm kind of, because I know it now, I'm shocked about how many things people don't know, because it's second nature to me. But a lot of this stuff is not. And it's getting that word out there that actually there are things that you can do to control your health and your symptoms and give you back the life that you want, to be able to perform well at work, but also to be able to have that life outside of work as well.
Yeah.
I go into companies and I offer a complimentary 30-minute employee wellbeing review and an engagement survey as well. So we look at, what are you currently doing? Who are the people that are working for you? What are the issues? Is it sickness absence? Is it productivity? Is it retention? Have you got disabled employees and you're not sure what to do about it? And a lot of companies say to me, actually, we don't have any disabled employees. And I think, well, if you look at the stats of how many people have an impairment, just because they've not declared or an impairment, it doesn't mean that they're not in the organisation. So yeah, it's becoming aware of that.
Yeah, honestly, I mean, it's funny. I worked somewhere once and somebody said that to me, and I was like, please. And I think when some people say to me, I'm the same, I go out all over and we talk to people and they'll say, oh, we haven't got many disabled. I'm like, you obviously have, but it's what are you doing to make it safe for disabled people to share with you that they have got disability, whether they want support or not? Because to me, if an
Absolutely.
organisation sits there and says, oh, I haven't got anybody, we're great, come on, somebody's not telling you something and there's something missing.
Yeah.
So onto the disability, because obviously that's another area. One, obviously from your lived experience, and also you do training on that. What would you say you've talked about some of the challenges there that an employer might have, in terms of engage with people aren't sharing. What other things have you found in your work, what employers could be doing better for disabled people?
So, yeah, I mean, I go into companies and deliver disability awareness training. And one of the things, well, we cover lots of things. Um, One of the things we talk about is who are disabled people, which I think we've kind of just touched on a little bit. There's still this preconception, and if you put disability into an image bank on the internet, what are you going to get? You're going to get a picture of a wheelchair,
Wheelchair, oh my gosh, 100%.
right? And 5% of wheelchair of disabled people are wheelchair users. 5%. So there's still that. One of the things we talk about in the training is who are disabled people, right? You've got neurodiversity, invisible impairments, mental health. How many invisible impairments do we have?
Absolutely. And I always mention that when I say to people, what do you consider, a non-immediately visible? And even like you know this, cancer, HIV, the kind of people affected by cancer, it's a class and disability. And I also think when the Equality Act came in, that mental health should be its own category, because some people don't consider that, that mental health is a disability, unless you know what you know. And I find
Exactly.
it really interesting. And when you said about, the wheelchair is, oh my God, I have to say to people so often, actually I said it to somebody last week, somebody sent me a picture and said, what do you think about this picture? I was like, can we not have the wheelchair user, please? Yes, we know there are wheelchair users and they're obviously, we need to acknowledge that. But a lot of people know and understand that there are disabled people and wheelchair users. We know this, it's something that's more acknowledged. But there's a whole wealth of issues that are not wheelchair users. Actually, the majority of people who are disabled are not wheelchair users. So if you're gonna, and I know it's easier, isn't it? It's visibly, it's easier to show someone who's a wheelchair. I get it. I'm not, major against it. But try and think of things differently. I say, come on, when it comes to, because that doesn't help the case of that people often think of that, oh, only. But what I have noticed has been really, really good in, like, sometimes you'll see on toilets or in car park, disability isn't always visible. So you're
Yeah,
getting more of that, thankfully. But we need to see more and more, because the same thing when I talk about disability to clients, you think they really they're getting better at that. And also you mentioned, having an ADHD diagnosis, there's more people that are recognizing neurodivergent conditions. So that's a good thing. Yeah, so sort of recognising sort of who is disabled. What else do employees probably need to do better when it comes to disability, would you say?
Um, I think, I mean, we have 80% of people have invisible
Yeah.
impairments. So creating that culture of awareness, first of all, around who, like you say, there's no legal obligation to disclose an impairment or declare an impairment to an employer. But how do we ask that question in terms of when you have your performance reviews? That's what can we do to support you? It's such a simple question. What can we do to support you to do your job to the best of your ability? So that's not basically saying, we want you to tell us what your health conditions are. It's what can we do to support you to do your job to the best of your ability? It's such a simple question. It's such a simple culture shift. I mean, when I do the training, I talk about designing out barriers from the outset. And there are so many barriers. There's institutional barriers, there's attitudinal barriers. We talk about, the difference between the medical model and the social model of disability. What the social model of disability is saying is that disability is caused by society. It's caused by obstacles or barriers in society. If we take those away, we don't have disability anymore. We might still have an impairment. So an impairment, could be a sensory difference or a mental difference or a physical difference. It could be any of those. But if we take away the barriers, we don't have the disability. So, like I say, barriers can be attitudinal. So, disability awareness is great. But also, people think about what do we think about when we think about barriers? We think about steps. We think about, again, we go back to steps and ramps, right? We don't think about lighting or
Even
break.
communication could be technology, it could be so many things, couldn't it?
Exactly, exactly. So, information and communication. So, and then also, I think recruitment practices are they discriminatory from the outset? Are we excluding people just through our recruitment practices? So one of the things I was finding when I went back to the world of work was we need 3 years of references. Well, I've been ill for a long time. I can't give you 3 years of references from the last 3 years, but I have a whole host of skills. Are we taking applications only through online portals, for example? Are there people that can't access those? There's so many things around the whole process from beginning to end that
Yeah, and I think I always say this, if any organisation look from, advert attraction all the way through to induction and retention, if they looked at it through a disability lens or through a neurodivergent, if they just improved it for the communities that are impacted by disability, I'm telling you, it would be a better process, full stop. It would be brought widened to all. You know what I mean? It would be actually better for everyone. And I think people need to consider that. And also, there's a myth. I always talk about the myth when it comes to what adjustments people might need, because sometimes people think, well, if we if I open the floodgates and I start asking about if people need adjustments, it's going to be too much. I went, absolutely not. That's not going to happen. You know, and it's, I've never known it in my whole work experience that does happen. But also, even if you did have a few more people, it's the right thing to do anyway. Like you said earlier, what are you doing to make sure somebody reaches their potential? And I think we need to take the fear out of it. Some people have that fear of, what if I ask? You need to ask. It's the right thing to do. And actually, I say it, some adjustments can be free. What somebody
absolutely,
might need, because of travel or because of anxiety, I don't want to travel early. So, in peak travel, they might say, well, actually, can I start earlier or later? That's a quick adjustment. Doesn't cost you a thing.
absolutely.
But people often think about, my gosh. And I think people need to be equipped. I think in every organisation there needs to be people, whether it's HR, EDI, well-being, that are knowledgeable about disability and well-being. There would be, but disability in particular, because just to allay those fears, really.
And the other thing that I'm quite passionate about is I see a lot of organisations that they have EDI training and they might touch on the social model, but it's not delivered by disabled people. So the disabled people's movement, you know, and disabled people's organisations and freelance disabled trainers, we're delivering it from a lived perspective, and that really changes hearts and minds. And I think, you know, it's about asking the question a lot of the time. So, you know, what adjustments do you think you might need? And it's moving away from this term reasonable as well.
But I
The
never
equal
say that. Yeah, exactly. Yeah.
The Equality Act is the bare minimum that we should be doing, the absolute bare legal minimum. We don't want to be doing the bare legal minimum. We want to have best practice in organisations. And it's how do we do that? You know, workplace adjustments. What is a workplace adjustment? Like you say, many of them can be free, but the employer's not expected to know everything about every health condition under the sun. That's where people like me in my other role can come in and create awareness and, you know, impact around different types of health conditions. But in terms of knowing how to support somebody with a particular health condition, you don't need any medical knowledge. You just need to ask the question. Often the disabled person knows what support they need. And if they don't know, you can work it out together,
Exactly.
you
And
know?
prepared to, if you need to seek help from professionals, get help. That's all you need to do. It's not like, you know, God, rocket science without one of a better phrase. Think, oh gosh, come on, people. No, absolutely. It's about, so anybody out there who's listening, please, you know, if you're an employer and you think, or an employee who thinks your organisation isn't doing enough around disability, please have a chat and say, look, I think it's something we need to do, because as we know, the barriers are still very much there for disabled people. You know, you're pretty much over the years, you're twice as likely to be employed. You know, the reason why in the Equality Act they were asked to remove all the information about. So I remember back in the day when you had to put an application in. Do you remember? And you used to have to put everything that was wrong, you know, or disability, mental health, but that was stopped luckily. But you imagine, you can be looking at it now because of the myths and negativity that people might think about having a disabled person. So no, absolutely. On the same sort of level, you know, vein of disability, but moving on to your welfare experience, you know, in the news now and always, so I'm not, you know, even though it's been heightened now, there's always been a negative perception, often, not always, about welfare and disabled people and rights. So, you know, particularly now they're looking at, you know, readjusting and changing the process of, as far as a way around people getting your PIP and you know, the different things. So tell me what you know was good for people to know around the welfare and disabled people as well, and benefits and rights and things.
So I think earlier I touched on the fact that people pay national insurance so that when they do, we could all be hit at any time with any kind of health condition, and we don't know when it's going to happen. The majority of people, so my other job, I have a private welfare rights service, and the majority of people that come through my door, well, my virtual door,
Yeah.
I would say 99.9% of people are genuine claimants and they struggle to get the benefits they're entitled to.
Mm.
I think even, you know, I've spoken to fraud investigators who have said actually benefit fraud, it's not as high as we think. I'm not saying it doesn't exist, but you know, the numbers are much less than we are led to believe through the media. A lot more tax fraud that goes on than benefit fraud. And the system is not easy, you know. It's not easy to get awarded disability benefits. It really isn't. And I think that's a bit of a myth that's still out there. And, you know, I've heard these people are taking our money. Well, no, they're taking their national insurance that they paid into the system before they got ill so that, you know, if anything did happen, then they would have something to live on. That's what national insurance is there for. And you can't claim benefits unless you've paid enough national insurance, or certain types of benefits unless you've paid enough national insurance. So I just want to bust those myths at the outset.
Absolutely.
And basically, the point of disability benefits is to level the playing field, because the cost of being a disabled person, there are a lot higher costs when you're a disabled person to being a non-disabled person. You know, whether it's that you're having to do more washing, or I'm trying to think of some equipment that you might need to be able to do your job that costs a lot of money that a non-disabled person might not need. Extra support you might need. You might need a personal assistant to help you with various aspects of your life. You might need a support worker at work. We do have the scheme Access to Work, the government's best kept secret, or it used to be anyway. We used to call it that. It is discretionary as well, and the waiting lists are incredible. I think it's something like almost a year at the moment to get an initial assessment, by which time many disabled people have lost their job because they haven't got the support that they need. But it is something that employers can call on to support their disabled employees. And it is essentially, it is a welfare benefit, but it's a discretionary one. It's not a, you know, a standard
So
one.
what do you think could be done differently in terms of welfare systems approaches to assessment and support? What do you think? Because you see it all, people coming to you.
I mean, for a kick-off, it's not even an accessible system. People that come to me for welfare benefits advice they are completely confused about what they can claim. The assessments, for example, I work with a lot of people with ME, and a lot of those people will really struggle to have an hour's telephone conversation. I've seen assessments go on over the telephone for 2 hours. One client in particular that I'll never forget, like his was a home visit. This was a few years ago. By the end of his assessment, he was visibly twitching and shaking. He looked like he was having a seizure,
Wow.
because the absolute exertion of having that conversation for 2 hours, and the stress as well, had actually caused a relapse in his condition. So we need to change the way we're doing assessments. We need to change the actual questions. It's totally not a social model. You know, the
Because what
level that
because I know people who have been very ill and definitely, I would say, should have got the assessment to get welfare and support. But because of those questions, what they ask, a lot, and you can tell me because I'm pleading ignorance here. From what I can tell, a lot of the questions, what they ask, are based on physical disabilities and not necessarily broader. Is that right? Tell us a little, because this is where I'm completely ignorant here.
So, for example, if somebody was claiming employment support allowance, or the, you know, the disability part of a universal credit, they'd have to pass something called the work capability assessment. Half of that form is to do with physical, the other half is to do with mental and cognitive.
Hmm.
But the level that you have to be at is so extreme that most people will struggle, especially on the mental health side, to be put in the right group. The physical health side as well, it's almost looking at, you know, do you have an impairment of your limbs, or, you know, is there a restriction in the way that you use your hands? It's not looking at the wider definition of all the different types of impairments that are out there, and also at the way that the forms are worded. It is not clear that you are being asked, could you do this thing? Could you do this movement repeatedly and reliably? So that they've taken a bunch of movements on the physical side that you might be expected to do if you were doing a job, and ask somebody, for example, can you reach and put your hand in the top pocket of a coat while you're wearing it? Well, yes, I could, but I couldn't do that repeatedly. Or can you raise your arms above your head? Well, yes, I could, but imagine you were in a factory or a supermarket and you were doing that all day long, stacking shelves. At what point does that become an issue? And that's where, when I'm filling in those forms, that's the way that I'm asking the questions. And that's how people are supposed to be legally assessed. But the forms don't make that clear. So when somebody's filling in a form on their own, you know, it's almost the way the forms are worded is setting people up to fail already.
And that's what I'm hearing. That's what I'm hearing. I'm thinking, wow, people, really need that support. And because they did not fill it out knowing what you're telling us. They're
Mhm.
then failing, and you think, wow. And as we know, often, not always, but often people then are disabled, then are more likely to be in deprived or poverty, be poverty, not have enough funds to live how they need to live to do the basics. And yeah, that challenge in
Absolutely.
itself.
I mean, the PIP assessments, the kind of questions that I see, and the things that are written on the PIP assessment reports afterwards. So, if you're not on a ton of medication for pain, often your pain is disregarded. If you're not on a ton of medication for your mental health, that can lead to being your mental health being disregarded. If you're not under a consultant for a particular health condition, that can lead to, your condition being disregarded. Think about postcode lottery. Think about the amount of funding that the NHS has. You don't have a limitless amount of appointments to endlessly see consultants for different conditions. You might get 6 appointments for your mental health, or 6 appointments with an ME consultant, and then you're done because the funding's run out. But if somebody's not under someone, that's then being used to say, well, they can't be that bad because they're not under someone currently for that condition. I see many people, particularly with ME, that are really, really drug sensitive. They cannot tolerate the side effects of drug medications. So that's another reason why somebody might not be on an antidepressant. I've seen people with mental health issues that have said, well, actually, I took an antidepressant and it made me suicidal, so I don't touch them anymore. But, and I'm not saying that's the case for everybody, but, in some people that has happened. That can be a side effect. And in those scenarios, those people's health conditions are being discounted because someone at somewhere high up has said, right, this is how you assess disability. It's not, is it? It's not realistic. It's not.
And for those
So
who are listening out of the UK, what advice would you give to anyone who is going through that process? Or even not, I know people who are going through appeal processes. What would you say to those people to get what they are duly deserve?
get professional advice. Absolutely. I know I'm not saying that because obviously I run a private welfare rights advice service, but there are many, many free advice services out there. I know that they are inundated. So you've got Citizens Advice, you've got your local welfare rights, you've got law centres across the country. You've also got disabled people's organisations, although not all of them provide advice. But yeah, get professional advice is what I would say to people, because it will dramatically improve your chances.
I mean, all of this leads, and also I want to say one final link before we sort of draw it to a close-ish, is that as well, make sure that if you're an employer as well, that you're supporting these, if somebody might be going through a challenge of having an adjustment in the workplace, but also dealing with things out of the workplace like this, we're trying to get support and benefits. So this is where line managers, organisations need to build really good relationships with their team, so that if they are having these challenges, they know they can get the support from work if they needed it as well.
Absolutely. Yeah.
So, in your breadth, I'm thinking here, we talked about all things, haven't we been? We talked
I
about
know.
welfare, disability awareness, well-being. I'm loving it. Is there anything else that you feel is really important in the areas that you cover, that you think we haven't mentioned yet, that'd be useful for people to be aware of?
I think for a personal thing, let's stop normalising our symptoms. If you go to my website, healthybe.co.uk, healthybe.co.uk, in the resources section, there is a questionnaire in there that looks at the sorts of symptoms that we normalise that are signs that the body's going out of balance. Have a go at it, see what you're normalising. A lot of times people do know what they're normalising, but sometimes people aren't aware. They're just like powering through.
Yes.
Any symptoms are a sign that the body is out of balance, and there are always things that we can be doing. So let's empower ourselves. Um, if I hadn't done that, I'd still be in bed. And I know, it's not as simple as that for some people, but absolutely, there's always something we can be doing to support ourselves.
Even in terms of, that's brilliant, and I think I'll be going on and getting that down myself. but also even nutritionally. I mean, is there anything, because we didn't talk about that in too much depth, because that's part of what you do. You said that's part of also what helps you recovery and things like that. Because I know that
Absolutely.
nutrition is really, rightly so, there's a greater awareness. Is there any basic advice? Obviously, if they want to see you privately, they can. You'll give a lot more information. But what key things would you tell people about? So one, check in about normalizing symptoms. What nutrition would you tell people as a, at least a basic thing that they could think about? I don't like the word
We
basic,
are,
but you know what I mean.
I know what you mean.
Yeah.
We are what we eat. I'm sorry to quote Gillian McKeith, but we are what we eat. What we eat makes our brain chemicals, it makes our hormones, it makes our skin, it makes our hair, it makes all of us, it makes our cells. So we are what we eat. If I had to give you just one tip, it would be hydration. Unless you've got kidney issues, and this is a caveat. So, if you've got kidney issues or cardiovascular issues, you may need actual, you may need supervision to increase your hydration. But hydration, water, good, clean water every single day, 2 litres a day, no more than a pint in an hour, which is half a litre. Never have
Mhm.
more than that in an hour. Don't go above 2 litres, but aim to get to 2 litres every day and try to drink it away from your food, because it will impair your digestion if you drink too close to your food. So what I say to my clients is nothing within half an hour before you eat, unless you've got to take a sip to take a medication or a supplement, and nothing an hour after you eat. And then try, water is not squash. It's not, it's not liquid. Water is water. The only caveat I would say is, you could probably get away with sticking a herbal tea bag in the water and still calling it water. But otherwise, we're talking water. We're not talking soft drinks. And most people I see are dehydrated. And if you can support the hydration levels, I've seen people get rid of migraines just getting more hydrated. I'm not saying it's that simple with everybody, but yeah, hydration absolutely key. And then the other myth, I think, is we should all be eating 5 vegetables a day. And most of the time, I don't see people that are eating 5. Actually, we should be eating about between 9 and 12 portions of veg every day.
Seriously?
Every single colour of the rainbow. And please, if you're listening, do not go from like 1 to 9, because your gut will hate you. What I do
My
with my
gosh.
clients is I step them up really slowly.
Wow.
And if they're an IBS client, there might be certain vegetables that would spark off the symptoms as well. So yeah, it can be a real minefield with food intolerances. So I kind of guide people through that. But yeah, we should be eating way more than 5 vegetables a day for things like cancer prevention.
I mean, to be fair, I'm saying that like shock, but I have been trying to have vegetable like at every meal actually now lately. Just even if it's a little bit of flipping rocket or salad or something, because you're getting older, you think more about these things. But people would no way be thinking that at all. So okay. Feel like I need to get you back to come and do more on that. Right.
I'd love
Anything
to.
else? Anything else for, in terms of employers around whether it's well-being, gut health? And also I will say that I'm really pleased that in the workplace now, there is a lot more awareness about gut health. There was a program, I'd actually a LinkedIn post, I can't remember what the program was called, but it looked purely at gut health. And I thought, hallelujah, because it was sometimes seen as an embarrassing condition. Da, da, da. So I think it's so good now that there's more awareness about it. It's not seen as such a challenging, I mean, it is a challenge for the person, but seeing as something you can't talk about. So whether it's,
Absolutely.
so is there anything else you want to say on the sort of employer angle?
I think engagement is important. So, as part of my complimentary employee wellbeing review, I supply organisations with an engagement survey to
Mm.
find out what their employees want. Because a lot of the time, managers can think they know what would be engaging or what would be a good topic to get somebody in to do a talk on, but oftentimes they might be wrong. And employees will actually tell you what they want. And if you get the engagement of the employees, you're going to have a much more effective employee wellbeing strategy. I think that's what I would say. And just having that calendar whole, not looking at it as a one-off nice to have, because bottom line is it affects profits, it affects productivity, it affects sickness absence. So, and what's one of the first things that always gets cut is employee well-being. And actually, it's a false economy, because the well-being of your employees is the well-being of your profits and organisation, essentially.
Absolutely. I wish, like I said, at least more people would realise that. And it's sometimes, whether it's inclusion, whether it's well-being, it gets, it sees negatively. But actually, addressing inclusion, equity, well-being, we've been talking about disability and well-being today. The whole thing, like you says, has an impact on your profits, whether it's because of retention, whether it's because of a whole number of recruitment we talked about. It makes a difference. Brilliant. Thank you so much, Bea. Like I said, I feel like I'm going to get you back to talk about something else. We may do that. So I think we've
That'd be
covered
great.
quite a lot. Because again, these things are everyday people, but I'm sure the questions I was asking and you were saying would have had those thoughts themselves. And hopefully this has given people an awareness of things they can consider, employees can consider. So thank you so much for your time. You've given your details out. So if anybody doesn't want to check out Bea, Healthy Bea, please do. She's got a website, she's told us that already. So please get in touch to find out more. And thank you very much, Bea. Until I see you again. Perfect.
Thanks for having me. Take care. Speak soon. Bye.
Thank you so much for tuning into the podcast. Please do spread the word about our channel and tune in for our next episode.